Next, we have Jason Wesco, Executive Vice President, Community Health Center of Southeast Kansas. Welcome.
Thank you. Excuse me. Thank you, Mr. Chairman and members of the committee, for listening to my testimony on this very important piece of legislation. My organization is a community health center, a large one. We have 43,000 patients. We serve patients in 10 clinics throughout Southeast Kansas, from Independence to Pittsburgh to Iola to Columbus to Baxter Springs to Parsons. We're very proud of the growth we've had. What we do is we provide primary care, medical, dental, behavioral health, and pharmacy services to patients regardless of ability to pay. So that means if people come to our clinic, they get taken care of regardless if they have $3 in their pocket or if they have commercial or Medicaid. What's important to know about that is that about 15,000 of our patients are completely uninsured. 96% of our patients live with incomes under 200% of the federal poverty level. That's about $40,000 for a family of 3. So we've got uninsured people, low-income patients. That is our focus. And compounding all of those problems, of course, directly related to those problems are health outcomes. Southeast Kansas, as has been well documented, and I know the legislators on the panel who are from Southeast Kansas understand this, we are the poorest and least healthy part of the state. In county health rankings, our average ranking is 93. Our highest is 77, our lowest is 100 out of 101 counties ranked. We have a regional problem. I say all that to set up the fact that I think we know a little bit of something about what we're dealing with here with people trying to access health care. So there are 3 things that I want you to take away from my comments. We believe that CAMCare expansion is good for communities in terms of economic impact, but also in terms of making them healthy. So healthier and more prosperous communities. And there's three ways that that really plays in for us, and that's access, maintaining infrastructure, and the actual physical economic impact of expanding CAMCare. So in terms of access, you've heard lots of stories already about patients in the coverage gap, but I want to tell you just one more. We have a patient who recently lost her husband in a car wreck, living on $700 a month, moved in with her in-laws, and decided that what she was going to do, because she had to be the breadwinner, was go to nursing school. You know what you have to go to nursing school? Health insurance. So she came to our clinic in Iola, she talked to our patient navigator, spent what can be a considerable amount of time, and she's in that coverage gap. Went out in her pickup truck and cried for about 45 minutes, got herself together, went home and went on about her life. What's different about her story is that the New York Times Magazine told her story. And do you know what people did? Not in Kansas, I will add. They sent us money to buy her health insurance so she could go to nursing school. And that is no way to fix this problem. So people like her need access to primary care. Primary care that prevents more expensive care on down the line, right? That's what we do. But also, as has been alluded to earlier, it helps people avoid or access specialty care. So what our primary care providers do, and we have 65 in our system, they see patients every day that they can't refer to specialty care. So they call specialists and beg them for advice, they do research, they do everything they can within their power to provide access to care for those folks. So expansion would mean expanded access for them. And as you'll see from my testimony in visiting with one of our providers, this was her quote, and I wanted you to hear her words. It's very hard to know that because of lack of resources, someone will die. To have to look in a patient's eyes and say your prognosis is different than that of someone who lives in another state. Your prognosis is less because you don't have insurance. And this gets to my point about infrastructure. For those of you from rural areas, you understand we have a critical problem in maintaining access to care in rural areas. And it's not just for low-income people, it's for all of us. So people like the physician who mentioned that, who made that quote, right? She is a person who could work anywhere. She could work in a health center in another state. So by not expanding access, we're at a huge competitive disadvantage. So we're taking an already fragile system and saying to a physician, hey, you know, if you go to Arkansas, if you go to Indiana, if you go to California, you could work in a place where you have access to specialty care. The work's every bit as hard, but if you work here for me, you don't have that access. So I think it's very important to understand that that workforce shortage is a critical problem in rural Kansas, and this would be a way to help resolve it. And I think that community health centers are a great way to do that. So CAMCare expansion will really help community health centers like mine expand into new communities. So I mentioned some of the places where we have clinics. We have one, a small one in Independence. We were able to open that in the basement of the Fort County Community Mental Health Center. They were been very kind to us to allow us to do that. It's big enough for one provider. But given the current structure and the fact that 35% of my patients are uninsured, I can't just open the clinic, I need to open in independence. I can't be nimble, I can't go where community need dictates. And so this legislation would help dramatically health centers like mine continue to grow. And so in terms of direct economic impact, we employ 300 people. We started in 2003, as Representative Renan well knows, with 11 employees, and now we have 300. And our average salary is $50,000. That's more than twice what it is in most of the communities we serve. It's almost twice what it is in Kansas. We provide good jobs. We spend $21 million a year. Again, 14 years ago, we spent $400,000. We're now spending $21 million. We think it's closer to about 29 with a multiplier effect. So not only are health centers taking care of people, providing very high quality care as is well demonstrated, but we're also providing jobs to people in those communities to help our rural communities stay viable. And so, while I understand there's a lot of numbers flying around and facts and figures, right? What this really is about is the people who, like Susan, who told her story, right? It's about the people who take care of us every day. This legislation creates hope and the possibility for healing for them. So for the people who grow our food, and the people who serve our food, and the people who cook our food, and the people who take care of our aging parents and our kids, on behalf of them and all of our patients and our board and all of our staff, I implore you, please vote this out of committee, and let's have a vote in the House on this and see where everyone stands. Thank you very much.
Thank you, Jason.